Hello medicos. Now we'll discuss about the median nerve course. So this median nerve which arises from the both lateral and the medial cord of the brachial plexus, right? So it has the two roots. One is the lateral root and one is the medial root. Okay. So lateral root which arises from the C5, C6 and the C1, C7, C5, C6, C7, and the medial root is from the C8 and the T1. Okay. So these all three roots. Then it enters into the axilla. So this axillary artery, see these directions, this axillary artery is on the medial side, right? So this median nerve is lateral to the axillary artery. Okay, so this median nerve is passing lateral to the axillary artery. Then it enters into the arm by crossing the brachial artery, and then it lies. Now see, this bicep tendon and this brachial artery is lying to the where lateral side. Now this median nerve passes medial to this brachial artery and the bicep tendon, and it will pass from the cubital fossa, and then it will give one branch to the pronator teres muscle. Okay, then again it move downwards and give the two branches, that is one is the anterior interosseous nerve. Okay, one is anterior interosseous nerve and another one, it will give one branch to the flexor carpi radialis. This is palmaris longus and this is flexor digitorum superficialis. Okay, so this anterior interosseous nerve, okay, it give branches to the flexor pollicis longus, flexor digitorum profundus. It will give one branch to the pronator quadratus muscle and continues as the articular branch. This is for the wrist joint and the inferior radioulnar joint. Okay, so this is the anterior interosseous nerve. Then posterior interosseous nerve, first it gives branches like we have seen the flexor carpi radialis, palmaris longus, flexor digitorum superficialis. Okay, then these nerve passes between the tendon of the flexor carpi radialis and the tendon of the flexor digitorum superficial. उनके बीच में से जाके it will give one branch, that is the palmar cutaneous branch. Okay, this is the superficial, and again it will go deep and pass deep to the flexor retinaculum, passes deep to the flexor retinaculum and give again the two branches. Okay, so one branch which supplies the first lumbrical, then second lumbricals, and then it continues as the palmar digital branches. Okay, which supplies the lateral 3.5 digits plus your nail beds. Okay, then another branch will give and it will become the recurrent branch. Okay, so it again is recurring. See, recurrent branch, it will give one branch to the opponus pollicis, one branch to the flexor pollicis brevis, abductor pollicis brevis, and again it continues as the cutaneous branch for supplying our like digital branches. So this is about the your median nerve.